Hello, everyone. My name is Julia Habu, a registered nurse and a nursing officer at DIF Medical Center. So, today on this channel, we're going to be discussing a very sensitive but necessary topic. We're going to be talking about suicide, what causes it, who does it happen to, and more importantly, what can we do to help? And to take us through this session, I have with me a consultant family physician, cognitive behavioral therapist, and a member of the Academy of Cognitive Behavioral Therapists in the person of Dr. Chika Anireto.
Hello, and thank you for having me so much,
Thank you.
Julia.
So, ma'am, would like for you to do a brief introduction of yourself. Just tell us a little bit more.
Thank you so much. So, I am a family doctor at heart, meaning that I treat people of all ages, both genders. I look after the family because everyone comes from a family, and how we act, behave, and even the illnesses we are predisposed to having sometimes is as a result of the family we come from. So I treat people with medical conditions. I'm also a psychotherapist, licensed and certified by the Beck Institute, which is an institute in Philadelphia in the US, and it's known for excellence in cognitive behavioral therapy, training, and practice. I'm also a member of the Academy, like you said, of cognitive behavioral therapies. So basically, I treat people with medical and psychological problems.
Thank you so much, ma'am. Well, I guess myself and the listeners are in safe hands. As you already know, she's very well certified. So we're going to begin with the first question. So for clarity's sake, because I'm sure a lot of people have misconceptions about what suicide is. So for clarity's sake, from your perspective, can you tell us what suicide is?
Thank you once again for that excellent question. So, suicide is the intentional act by someone to take their own life. So, it's when someone intentionally kills themselves, basically. And I just want to point out that I see it as a form of an extreme coping mechanism, is an escape from difficulties that people face. So I say that because when you say suicide, some people look at it as maybe selfishness, maybe weakness, maybe you're so weak you can't take what we're taking in this country, for example. So the fact that someone would take their own life is a pointer to the extreme, enormous stress that they're facing.
Okay. So I think it's safe to say that we can always assume that people who take their own lives are selfish or weak people.
Absolutely.
Okay. Thank you so much, Ma. So I'm going to go to the second question now. I know that many people think this doesn't happen like a lot around here, especially Nigerians. Nigerians are so hilarious. They could say, oh, it doesn't happen to a Nigerian man, it doesn't happen to a Nigerian woman, or we're not as weak as other people. And I wouldn't like to mention a race. But then, question is, can you give us like a global statistics so that we can understand better this scope?
Thank you so much. So actually, suicide ranks number 21 amongst all the causes of death in the whole world. So annually, globally, about 700 to 740,000 people kill themselves. And this is global. So these statistics are more in countries where there are lower income and middle income classes, countries such as ours. So not only is suicide ranked number 21, this is among the entire population. It's ranks number 3 amongst young people aged 15 to 29. And you know that in countries of lower and middle income countries such as ours, we have a younger population.
Mhm.
So in Nigeria, I think we're coming to know now that suicide, unfortunately, has reared its ugly head here. So the statistic for our country is 7 out of every 100,000 people. I dare to say that's probably an underestimation because, unfortunately, in my clinic, a lot of my patients within this age group, 15 to 29, are actually suicidal at different stages, different levels of risk of suicide.
So that brings me to the third question. I would think that there are a particular set of people that this happens to, maybe a particular gender, or is predominant in a particular gender or age, or I don't know, workspace. So can you like tell us who is most at risk to be suicidal?
So thank
That's
you.
from your experience.
And this is why I'm really interested in this topic because, like I said, there's people within the ages of 15 to 29. For them, it's number three, the third commonest reason why they take their lives. So the people most likely or highest at risk for committing suicide are men. So it's interesting because women will attempt suicide more, but men will complete them more often. So for every one person who tries to kill themselves, about 2025, more women than men have attempted. The reason why this is so is that men tend to choose lethal means. Men go for the throat. They split their throats, while women, maybe because we don't like pain, do we? No one likes pain, but I think women tolerate it less. So women would use less lethal means and then end up surviving than men.
Wow.
So this age group, young people, mostly men, but women are gradually catching up to men as well, are more likely to commit suicide.
Wow. When you said that, I would have thought that women don't do it more because women are stronger than men. I would have assumed that.
And I think I understand where that question comes from. So women are more expressive of their emotions than men. Men, because of societal expectations, there's a societal expectation, cultural expectation. A man should be strong, the shoulder to lean on, stuff like that. So women, it's more socially acceptable for women to cry and lean and, play the whole and I need help. Whereas men need help and they suffer silently. In fact, they bear the burden of the entire family and they can't even ask for help because that would be interpreted as weakness. So men, as well as anybody else, as well as women, do feel, especially young men, do feel this intense emotional and social stress, which is what leads up to suicide a lot in this population. It's just that they don't talk about it. And again, another thing I see is that because women, because they're the ones that look after the children the most, they are more in contact with the healthcare system. So you want to take your child for immunization and you pop in and see a doctor and complain. You come for antenatal care, you pop in and you complain about your mental health or whatever. But men basically pay the bills. They're the ones that, foot the bill and, they're out looking for money and trying to provide and trying to live up to that stereotype of. So do you want me to go into details as to the specific reasons why this population would end their lives?
You've actually said a lot, but you could throw a bit more.
Love to, because for me, this is the point of this discussion, isn't it? So there's so many reasons, but the first on the list for me from experience is just this intense emotional and social pressure that young people face. Emotional pressures from maybe failed romantic relationships. And this would be because at this stage in life, talking about 15 to 29 years, anatomically and functionally, the brain is not fully matured. This happens at about 30 years upwards. So these people, talking about young people, they are at a vulnerable part of their lives and they have expectations to live up to, academic expectations for those who are in school, financial expectations for those that are working, expectations to get money, make it big, um, get money quick, and all the while still dealing with the vulnerability because of their age and development. So some people would cope with substances. They would use weed, they would use cocaine, they would smoke and things like that. And unfortunately, these substances increase impulsivity and impaired judgment, increasing the likelihood of their ending their lives. So it is these stresses, the emotional and social stresses, sometimes even from family, conflict, from parent-child, difficult interactions between parents and their kids, romantic relationship, platonic relationships, financial issues, academic pressures. These are the things coupled with that not being able to reduce resilience because of what I told you about that lead to suicide. Other things are mental health disorders. So we know depression. Depression comes with hopelessness and low self-esteem, which is also ripe, common at this age group, increases the risk of depression. Depression increases the risk of hopelessness. Hopelessness increases the likelihood of suicide. Another reason why our young people would kill themselves is they have access, especially if they come from homes where there's no structure in terms of no adequate supervision, maybe, economic hardship in this country and other low, medium income countries. So people have access to poisons, which is the common ways we end our lives in this part of the world. In other climes, it is guns and firearms that they use to kill themselves. So access is really important. Another reason is vulnerable groups. I want to mention and draw attention to people who are vulnerable, like prisoners, refugees, displaced people that have a different sexual orientation, LGBTQ people who feel misunderstood, who feel isolated and alone in their difficulties. And it's illegal in this part of the world. So a lot of them feel like they don't have a voice and nobody wants to listen to them. So when they're faced with these stresses, suicide becomes an attractive option.
Wow, that's a lot. That's a lot. I wish we could like okay, I'm just gonna ask further. So is it safe to say that one of the groups that are pre-exposed to committing suicide are those who are not from, because when you mention not structured families, that's like very common all over the world. I wanted to say Nigeria, but I think it's everywhere. We have people who are separated from their parents, people whose parents are not together, or who have watched domestic violence. We see that this is like a subgroup of people who are very, 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 very predisposed, or we could get that from them.
There's so much for that question. So for clarity, when I say lack of structure, I don't necessarily mean the absence of one or two parents, even though that definitely would play its own part. Sometimes you have a family where you have both parents, but they're very busy chasing money, trying to keep the family afloat. So kids are basically left to themselves. That's one. Then there's some parents who, probably because of the way they were brought up themselves, just don't have the skills to parent. They just don't know how. They love their kids. They could do anything for their kids, but they don't know how to set boundaries, for example, how to discipline, for example, when to say no, how to say how guidelines around the use of devices, for example. So parenting might tend to be more permissive than is helpful for the kids. So that's what I mean. Of course, then you have the parents that are physically present but emotionally absent. So parents themselves are dealing with a lot. Then you have the parents who may have maybe mental illnesses themselves. Parents are dealing with depression and then they can't engage with their kids as they would like. That's what I mean by lack of structure. So the kids may have two parents or may have maybe have lost a parent or something. But I'm not saying that maybe single parent households are more parents from single. No, I'm not saying that. I'm saying even if both parents are present and the parents are not intentional or do not know how to be, or there is no structure. When I say structure is someone who is looking out for how what kind of foods the kids are eating. Is it nutritious? Someone who is looking out for their bedtime routines. Do they go to sleep at a particular time? Someone who consistently enforces discipline. Something like that. That's what I mean. So you don't necessarily have to have a single parent for that. There are some single parents that have structure in their home. And there are some times when both parents are, and there is no structure.
Okay. So just one more question to add to this. So just like in medicine where they say indications for CS, we could say previous CS, right? So now it will bring me to two questions. A person who has once been suicidal, is that an indication for another suicide attempt? And a person with family members who, just like family history, who are suicidal, is that also an indication for another, for an attempt at suicide?
Yeah. So I love the question. Thank you for asking because you are absolutely. It is the biggest predictor of suicide, not just suicide, completed suicide. So if you're a medical personnel, you want to be on the lookout for that. And yes, if you have a family member who has ended their life, it's not like it runs in the family in that way. It's more like you learn to cope with difficult situations by quitting and leaving the world. So it's like the person who has died by suicide is modeling that this is what we do when things get difficult. We exit the world. So thank you. Important questions.
Yeah. So that brings me to the next question. The next question is for people who have family. I think you've already started on that, but I'll just ask more constructively. So for people who have family members or friends that they're worried about, how can they tell the warning signs that, oh, this person might just want to quit? How do I tell?
Thank you. So to be very realistic, sometimes there are no warnings. Fortunately, I was present when a colleague of mine ended his life, the doctor, by suicide. I can tell you we had no idea. None of us saw it coming. In fact, that incident, it saddened us intensely and it provoked us to do something to make sure it never happens again. So why that's so is that some people are adept masking their pain because they don't want to be stalked. So they're sad, they're depressed, they are lonely, and they put on a mask and a facade of, I'm okay, everything is fine. And you might even ask, and they'll be like, everything is fine, oh, I'm great. And they're doing their work as well as they've always done it. So it's not, unfortunately, always easy to tell. However, sometimes they let slip some telltale signs that you can catch. So for someone who is typically an extrovert, for example, someone is outgoing and extroverted, one telltale sign is that they might be more withdrawn, they might be less talkative, they might reply in monosyllables, whereas before they would be more talkative and be laughing and stuff like that. Then those who are more introverted may become reckless in their behaviors. They might intentionally put themselves in harm's way. They might do things out of character, like staying out in parties late, driving drunk, fast driving, intentionally with the hope, secret hope that somebody would just knock them out and kill them. Another way you can tell, I have found, is if you're the kind that is on social media, the display pictures tell a lot about what someone is going through and what's the season of life that they're in. So I've come to learn that people who are either depressed or anxious or even suicidal, there's a very dark theme about their DPs. So you might see it's dark, someone is crying, a lot of blood. And then if you are maybe a parent or a good friend to someone who might be suicidal, you might actually check if you check their search engines, you would see things like easiest way to commit suicide or the most painless way, things like that are clues. And then some people might actually begin to talk a lot about death. So they're always talking about how hopeless, doom and gloom, sad things are. And some people will go to the extent of giving out valuables and things that is important to them. So these are telltale signs. Sometimes people would flat out write a suicide note. Wow. Sometimes this is a cry for help. Sometimes they don't intend to end their lives, but they're looking for someone to help them with what they're dealing with. So this, goes back to what I said earlier. Suicide is not because you're weak, it's because you are about to burst at the seams. It's because, your things are you're no longer able to meet up with what you feel is expected of you. So it's really like it's an extreme coping mechanism. It's an unhelpful one, no doubt, but it's an extreme expression of pain, intense pain, emotional pain. So these are some telltale signs that you.
Thank you so much, Ma. Um, thank you. I really appreciate this topic. It's a really sensitive one. So if you're watching and you feel like you need to take a break, I think that's fine. And then just come back and continue. So I think that brings us. No, I was going to add something when she said something about the search engine. For a lot of us scroll a lot on TikTok and Instagram. So there's something that's called the repost button. So you can always check what people repost when they repost more of sad stuff, just to add to what she said, when they repost more of, you know, nobody knows what I'm going through. It's like a theme thing. Oh, life's so private, nobody knows I'm trying to kill myself. So you could see reposts like that on their social media, on their TikTok. So you can always check out a person's repost, what they like to reshare and stuff. So that brings us to the next question. And this is part I'd like us to lean into a lot because at the end of the day, we're trying to offer help and solution, right, to a problem. So based off of problem solving skills, what do we do when we see these telltales, these signs? What do we do? Because a lot of people be helpless. They don't know what to do when they see a person exhibiting some of these signs. In as much as she already established that they may be known, so you don't go blaming yourself, oh, I should have known or I shouldn't have known or whatever. But what do we do when we see these obvious signs?
All right, so thank you again. These are all very excellent questions, Intel. Thank you for watching. This is a difficult conversation to have. Nobody like talking about text, do they? Okay, so what I would say is be physically present, be there. If you're not physically present because you're in a different location, be there, virtually. Be on the phone, literally. Do not get off that phone. Why? Because your presence would serve as a deterrent to them ending their lives. Most people want to end their lives in privacy. Of course, nowadays we have people live streaming their deaths on social media, but most people see other people as a deterrent to their wanting to end their lives. I want to just quietly go. So be there to listen. If you don't have anything to say, just stay there physically if you can, if at all possible. If you're watching this, I'll say, see if you can encourage, see if you can remind them of difficult times in their lives where they have overcome what look like unsurmountable obstacles. So this points to their resilience and their strength. And I would also say to remind them of the reasons for living. So for women, I like to remind them of their children. And I'll say, what do you think would happen to these kids if you're remember them? A lot of times, no one can love a kid like that. For the men, I'd like to remind them of their dreams, goals, what they've always wanted to achieve in life. And then I love to point out that why would you use such a permanent solution for a problem that is temporary? It might look like you don't have an escape route right now, but it's because you're so intensely overwhelmed. How about going to talk to a professional and we can problem solve and look at other options? So in therapy, I know I'm going back and forth. I'll go back to what you would do, but I just wanted to point out that in therapy, what I do a lot is I say, what is the advantage of taking this? Why would you want to do this? And a lot of times people would say, everything would stop. The pain would go away. I would be at peace. And then I would say, what if I told you that there's another way to make everything stop and be at peace and still be alive to achieve your goals? So I would lean into, hope for the future. Back to what you would do if you're the one, I would say take away any means that they could use to harm themselves, in addition to what I've said. So the knives, the ropes, jagged things, broken bottles, things that can be broken and rough edges, poisons, pesticides, anything around the house that someone can use to end their lives. I would also say, please, please, please encourage them to see a professional. In fact, if it's possible, accompany them to see the professional because some people might want to throw you up and say, I promise you, and then they have no intention of doing that. So these are the things that you could be if if you're able to validation always helps and to validate you basically say it makes sense that you feel this weight of what you're going through because a lot of people it's difficult to understand why someone would want to take their life so there's a tendency to lean on you're not the only one going through this we're all suffering if it doesn't work but when you say stuff like that it helps a lot where you say oh I get it well, from your perspective this is difficult it makes the person feel seen, feel heard, feel listened to.
Oh, thank you so much, ma. So I was going to ask one question, right? So, for people, maybe because I've seen it on TikTok, so for people with bipolar or some other conditions, right? They tend to go through the route of mercy killing, something like that. No, I've forgotten what it's called, but I think mercy killing kind of same thing. Yeah, kind of explains that. Is that also termed suicide?
You have the best questions, Julia. So there are some clients that they actually have medically assisted
Death.
yes, medically assisted suicide. Yes, that is a thing in countries. Canada, for instance, they have something like that, but they have strict guidelines. The person must have been assessed by psychiatrists to ensure that they don't have a underlying mental health disorder. Person must have either a mental or a medical, sorry, not mental, a medical illness that is terminal and had no cure, and some other guidelines, things like that. So that is a different ballgame altogether. We don't have anything in Nigeria. So in other climes, yes, you can medically assist suicide, but we don't have that. So we see every suicidal ideation, every thought of ending your life and take it very seriously and we act very aggressively to prevent that from happening. I hope I answered.
Yes, you did. So, I'd like for you to say something to everyone watching because I know it's not just people who are trying to attempt suicide that are watching or people who are exposed to it. I also want you to say something directed at people who have watched their loved ones commit suicide because most of the times I feel people who are in that category end up blaming themselves, especially after having watched this conversation. You might say, oh, I saw this, but I didn't know, which is probably not your fault. So maybe like an encouragement to them, it's not your fault, and stuff like that, and how they can also cope with.
So thank you for that question. So if you're watching this and you fall within that category, perhaps you've lost a loved one. First of all, my heart goes out to you and I'm so sorry for your loss. And I just want to say that, first of all, you're not a mental health expert, are you? So you can't have known all the things that I'm talking about. And it's not your fault. You're not to blame. And it doesn't mean that you let them down. It doesn't mean that, you weren't a good enough brother or mother or father or, whatever your relationship with them was. What I would encourage you to do is to immortalize their memories. Use this death, turn it into something good. Channel the pain you feel, channel the grief you feel into something that would help somebody else so that this would never happen to somebody else again. In terms of you not seeing it, you not catching it on time, I literally just said, not too long ago that even in a hospital where we have doctors and trained people, we missed it. So we missed it. So sometimes these things are internal, and some people, are very good at masking how they really feel. So having said that, I think my best suggestion is channel your pain into something that will outlive them, something that will stand as a memorial to them in years to come. And I actually, have known people who did that, where they had set off foundations and they had NGOs that, came out of so much pain. So that's what I would say. Then, if you permit me to say one more thing.
Oh,
I would say to those who, are affected by suicide, that's another trauma on its own. That's another pain on its own. So I would say, you can overcome this. This doesn't have to be your reality. You don't have to live in the shadow of, oh, that person whose dad or mom or sibling ended their lives. You are a different person and you do have your whole life ahead of you, but there's a lot to live for. There's your dreams, your goals, and all the achievements, the purpose for which you were put into this world. So remember that.
thank you so much, ma'am, for sharing your expertise with us today. The conversation may have been heavy, but it was quite important and it's life saving. So, to everyone watching, please seek support when necessary. Talk to someone because your life is valuable. Uh, the problems are not permanent. She already said that life in itself is temporary. So why try to cut it short or end it when you have opportunities to do more? So please reach out to someone. Plus, here you can always drop your questions in the comment section. And if your questions are rather private, we're going to drop an email with which you can reach out to us. Visit, seek professional help, visit the clinic. Here we have Sunshine Clinic. You can always come to us at Diff Medical Center and then you can, have a one-on-one session with her. She's amazing and she takes her time to speak to us. So thank you. Thank you all for watching once again. You can drop a like, share the video, send it to someone that needs it, and we will see you when we're having our next conversation. Thank you.